From Studio A at 1 Biloxi Square in beautiful Fort Worth, Texas. Welcome in, everyone, to the Grandpa and Pappy Show as we introduce our show with some great music from my buddy Brian Emberton up in Tennessee. We talk about a picker.
Our little hillbilly picker.
Guy can do some picking. Thank you, Brian. I
If you wanna-
appreciate
you
it.
wanna check out some of his new stuff. You can get on YouTube. He's all over there. He is involved in a band called Them Damn Hillbillies.
Yeah, and it still amazes me how some of these musicians are getting together online and actually doing some dadgum good work, producing some good music.
Technology never ceases to amaze.
It really doesn't me either.
Well, speaking of musicians, our buddy Thomas Gabriel, I was on the phone with Donna Sue Roberts.
His manager.
Yeah.
Yeah.
And they are talking about doing a full-blown Texas tour in November. So any of you folks out here locally or in the state of Texas that might have a venue set up for musicians, if you'd like to have a damn good musician come visit, hit us up. We'll hook you up with Donna.
Man,
And I'm looking forward to
that's
that.
some good news then.
Yeah.
There's some good news on the COVID front.
Yeah.
Yesterday, the state of Texas governor, Abbott, released some more facts that allows restaurants and venues like that to go up to 75% occupancy,
Not bars, though, right?
but not bars.
No, he's pissed a lot of people off over there.
Yes, he has. And I don't know if it's because of the information he is receiving from supposed experts, Pappy, or what?
I don't know.
Because I know he's been wanting to. I saw an interview with him. He said, "Man, he really does want to, but he's so scared of getting Texans sick." But we're talking about that in a roundabout way today, Pappy, on a suggestion you made on our Facebook page, and that was, should hospitals pay back the COVID money that they have received? And we got a ton of comments from you.
What are your feelings about that?
Well, you know, I think the thing that bothers Americans the most is the fact that we can't get actual figures.
Well,
We can't. A lot of this, and you and I touched on it, talking about, we've heard that if you are treating a COVID patient, you get $13,000 and up to $35,000 if they're on a respirator and die. Mm-hmm. Well, I did a little research yesterday from factcheck.org, and this all started on social media and all the things that we have read and researched due to a interview that was done between a Minnesota senator who happens to be a physician, a 35-year physician before he ran.
okay.
And he gave a interview on Fox News, and it had to do about Medicare payments for COVID-19 hospitalizations. And basically what he said was this, and it just got kind of all turned around. He said, I would remind anyone that anytime healthcare intersects with dollars, it gets awkward. Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000, 3 times as much.
Jesus Christ.
Nobody can tell me after 35 years in the world of medicine that sometimes those kind of things impact on what we do. Now, that's what was said.
Well,
Okay.
I'm inclined to agree with you.
But what it boils down to is that the Medicare insurance that the federal government has for 65 and older patients, what they do is they have a standardized formula where they pay so much to the hospitals on the patients. But if they are diagnosed with COVID, then they can file up to $13,000 over that amount that they would normally get for the insurance if you tested positive and you were in the hospital, and up to $35,000 if they're put on ventilators and eventually pass away.
Well, my question is this: from a hospital standpoint of view, why is a diagnosis of COSIS that much more special or important than, say, a cancer patient or somebody's got pneumonia?
Well, it
or a
has,
broken bone.
Yeah, it has to do with the multi-billion-dollar bill passed by Congress.
Yeah.
And it adds extra into the Medicare payment system so that hospitals do get payments.
But why?
Well, that's just the way they set it up.
They're in like, well, yeah, but why? They're in my opinion, lies an agenda. It's agenda fueled.
Yeah. FactCheck.org said Medicare, who is the federal health insurance program for Americans 65 and older, a central at-risk population when it comes to COVID-19, pays hospitals in part using fixed rates at discharge based off of a grouping system known as diagnosis-related groups. Now, the CARES Act, which I alluded to just a few minutes ago, passed by Congress, it created the 20% add-on to be paid for Medicare patients with COVID-19.
No.
The act further created a $100 billion fund that is being used to financially assist hospitals, a portion of which will be used to reimburse healthcare providers at Medicare rates for COVID-related treatment of the uninsured. And that is according to the U.S. Department of Health and Human Services. Now, here's where I think the opportunity, Pappy, if I may, for fraud comes in. Because if you look at the CDC guidelines and how it's stated, I can see how somebody could manipulate this a little bit. The CDC guidelines says that officials should report deaths in which the patient tested positive for COVID-19. To me, that says any deaths, right?
Well, prime example, you get involved in a car wreck and you die, they're liable to toe tag you as a COVID patient.
Yeah. And then it goes on to say, or if a test isn't available, if the circumstances are compelling within a reasonable degree of certainty, it further indicates that if a definite diagnosis of COVID-19 cannot be made, but it is suspected or likely, the circumstances are compelling, in other words, within a reasonable degree of certainty, it is acceptable to report COVID-19 on a death certificate as probable or presumed.
So that would make a difference in how much cash they got paid for doing it, I guess.
Well, you know, and I'm a simpleton. I'm just an old country boy, okay? But when I read that, I see all kinds of, what do they call them? Loopholes?
Loopholes, right. Loopholes.
That you could take a look at that. But it just kills me sometimes because there are loopholes. But this senator, Dr. Jensen, he did say that, let's see here, he did say he did not think that the hospitals were intentionally misclassifying cases for financial reasons.
Bullshit. They've been doing it forever. It's not just the COVID, not just the cornholio disease. I had a doctor's appointment yesterday, and I asked Dr. Davis, I said, what's your stance on the COVID virus? And he kind of looked at me. He said, Joe, you don't have to wear that mask in my office if you don't want to. He wasn't wearing one. So,
well, there you go. To me, that speaks volumes.
Yeah, it tells me he's not a Democrat. But he
or it just tells me he knows something we don't, you know.
He said it's a bunch of bull. He said, I really don't want to get into that. He said, because that's all I'm talking about these days. He said, I'm done with it. He said,
I saw a guy
no excuse
yesterday
for
on the
this
news
crap.
that was talking about, he said, COVID-19 is nothing but a virus.
That's it.
You get 24-hour bugs, viruses, 48-hour bugs, which are viruses. The flu is a virus. You know, he said this should not be any different, and he was talking about the different hydroxychloroquine and some of these other things that physicians around this country have been prescribing. So,
Well, I'm not trying to second guess what
me
caliber
neither.
about. I mean, it's bad. It's bad mochas, big time. You know, I mean, but if you get it, it's treatable. You know,
it is that.
just like the flu is.
So what we're trying to say to you folks is that if you are having some kind of symptoms that you even suspect may be COVID,
Get your butt to the doctor.
that's right. Get yourself tested. They can knock it out. They can knock it out.
Yeah.
And that's and we're not downplaying the severity of it. I know it is more prevalent as far as the death count goes
Yeah.
for people like us that are over 65 years of
That's
age.
true.
You know, so.
That's true.
Well, we got a lot of comments in today
We
from
did,
you,
yeah,
our
as usual.
clients, our customers. Got clients on the brain. But, you know, I do appreciate you taking time because just by reading these and transcribing those comments over to our script for Pappy and I, we can see the general overtone from you is, yeah, they should pay it back. You don't believe that. So
Yeah.
let's get into it, Pappy,
Let's do it.
and let everybody know
Okay.
what you're thinking out there. Catherine Barclay Doss asked us first, I want to know just where this money comes from. And
Right
Catherine,
out of your
hopefully with the
hard-earned money.
research that I just gave to you to start the program, will answer that question for you. Yeah.
Well, in my opinion, it's our money.
Well, yeah, either way you look at it, it's
Tax money,
taxpayer.
yeah. Danielle Sharp said she thinks the fact that they receive any money at all is just wrong. If it is true that hospitals get thousands of dollars to treat COVID patients and thousands more if they die, it just prompts all kind of fraud, which you hit on.
Yep.
There are too many stories circulating of this being done every day in hospitals.
And that's true.
It is true. It is true.
You hear that every day.
Yeah, well said, Danielle.
John Rockholt said absolutely they should pay it back. And they should turn around and sue House Democrats for writing incentives for overcounting COVID deaths into the legislation.
Well, and it's my opinion that once a Republican holds the seat in the White House again for the next 4 years, that'll be addressed.
Well, it
No
all
doubt
depends
about
on whether the Republicans take advantage of November voting and they
Yeah.
regain control of the House. That's
Yeah.
that's the big thing.
Well, it'll be a miracle cure if they do. You know?
Yeah, that's true.
All of a sudden it'll be gone. So
Gregory Cheatham, Tiffany Miller, Richard Hall, Skip Starkey, David Walker, and Daniel Sharp. Forgive me, Daniel. They all agreed, Pappy, that they should have to pay it back.
absolutely. Michelle Tipton said, "Hell yes! If they had misrepresented, then this country would not have to go through all this crap for the last 8 months.
Amen.
They need to pay for what they have done, and so does the government."
I agree with that. I do agree with that.
As well.
Nicole Calderon says if we falsely reported any of our money, we'd have to pay it back plus some.
Yep.
Fine them. To which Chris Schomburg agreed by saying yes, and fine them heavily. It's fraud.
It is pure and simple fraud. You know, there's the agenda. It's all about chasing a dollar. Is what
Boy, there it is, right there. You just nailed it right on the head.
Erica Foltz up in Louisiana, Stephen W. Crenshaw, Darla Walker, and S.D. Holland, Tina Grove Meeker, and Michelle Motley Smith all agreed that hospitals need to pay all that money back. I concur.
Well, you can see by the general overtone on just the opinions we've already read. Most of you out there are thinking the same thing.
You know, and it goes much deeper than that. Look at how it's affected our economy.
That's correct.
Look at how many people's lost everything they've owned over.
That's
these
correct.
days. That's not right.
It's not right. Brad Cook took an optimistic approach by saying Trump will reel them in after he gets reelected. You mark my word. I think that's basically echoing what you just said,
Yeah,
Pappy.
yeah. Randy Thomas said it's pitiful to hear stories of people dying from pre-existing conditions like cancer or heart attacks. I lost my place. But if they tested positive before they died, the hospital gets more money. Who does that? My sister-in-law is a nurse in a big hospital in Oklahoma, and she said no matter who is brought into the emergency room for any kind of trauma, they're tested immediately, and if they test positive, even though if they died of a gunshot wound, they were listed as COVID death. It just isn't right.
And that's true.
You know, we've got some friends that live here. Sherry's, is it her cousin? That's a COVID nurse.
Yeah, well, yeah. Yeah, and she kind of echoed the same thing.
Yeah,
Yeah, so
absolutely.
a lot of people like Tommy Parker, Lisa Newcomer Byram, Stacy Vaughn, Lisa Seeley, Christina Hoffman, Helen Johnson, Antonio Renteria, and Jerry Blum all said yes, they should be held accountable and forced to pay that money back.
Yep. Christine Wiley says, I would say yes, but on the downside, if we make them pay it back, they'll charge more for services, which will hurt us. They'll find a way to get that money, won't they?
Somehow,
Create a
some
new
way.
damn disease.
Isn't there a song like that? Somehow, some way, yeah, whatever. Let's see. Paulette Morrison agreed with Christine by saying, look at the logistics of it all. Hospitals are big business, employing many professional people and other essential workers that cost a lot of money.
Yep.
When COVID hit and the states took action to try and control it, many surgeries were put off, we know that for a fact, and many patients were sent home to avoid spreading it to more serious patients that needed to stay.
Yep.
With that, their revenue dropped to almost nothing, and that is where the government tried to rescue them. By giving them so much to treat each patient, all while exposing their staff, it ensured that the hospital would have funds to continue. Has it been abused? Sure. But without that support, many hospitals would have been boarded up and no medical help available to those who really needed it.
That's well said.
That is very well said.
Yeah, and I agree.
When you look at it like that, it sure is.
Netta Britton said yes. A cheat is a cheat. There are people all over America serving time for cheating, fraud, and restitution is mandatory, as well as doing the time. They are no different, in my opinion.
Mm-hmm.
And I'm inclined to agree with you, Netta.
And I keep referring back to some of our really good friends. They had two friends that are elderly that decided, you know, because we're old, might ought to go get tested.
Yeah.
And they went to one of the drive-in testing sites here in Fort Worth. True story. Went to one of the drive-in testing sites here in Fort Worth, stayed in their car. They came out, filled out paperwork, and told them it'd be a short time and they'd get their test. Well, they waited for 2 hours. 2 hours. To an older person, waiting 2 hours, that ain't gonna cut it.
That's an eternity. Yeah.
So he just cut out a line and went home. Next day, they got a call from the testing center that said they both tested positive. They hadn't even taken the test. I thought that was hysterical.
And there you have it. I mean, you can drive through CVS Pharmacy's drive-through and get swabbed, get tested.
No kidding.
Drive-through. Yeah.
Donna Briggs Moss says if they falsely reported it just to get money, then they certainly should have to pay it back.
Yeah.
Heather Roysden agreed by saying, hell yes, and they should pay to have the records fixed too.
Yep.
Tammy Quick Kroll also agreed by saying absolutely every single penny.
I think they should be fined and/or. I mean, it's fraud.
So let me
Law is law.
ask you a rhetorical question then.
Okay.
If the government did take that stance, okay, and they figured out that fraud had happened in whatever form or fashion that it was taken,
Yeah.
even if it's doctors classifying it wrong, should the doctors be held for fraud and go to jail?
Hell yeah, they're making money off of it too. Why not? I mean,
Well, that's a good way to look at it.
just as Netta Britton said, a cheat's a cheat.
Yeah.
If it's a penny, you're still a cheat. If you're a thief is a thief, you know.
Mm-hmm.
But yeah, I think anybody involved with it knowingly accepting money, knowing that it's not right to do so, and capitalizing off of it, that's fraud.
I agree.
You
I agree.
Do the time.
Well, that's what our parents taught us.
Yep.
You know.
Oh yeah. It's the kind of thing used to make my butt hurt. That Dad would say. Adam Smith simply said, "Yep, but will it happen? Nope. But will it give Trump the right to claim on their debit and finally standardize prices on procedures in our public medical facilities? Yes, you better believe it."
Mm-hmm.
It's one way of looking at it.
Yeah,
I guess, so.
it is.
Oh.
Russell Curlin said, yes, then charge it back to who told them to do it. Debbie Howitt, Michelle Safer, Mona Hardin, Christina Cornstubble, Terry Crow, Ken Mason, Deborah Hanks, I should say, and Gregory Cheatham all agreed with him. Mm-hmm.
Well, that's, fair is fair. You take something,
Yeah.
pay it back.
Yeah.
And finally, Mark Rutherford said, "What is scary is the fact that no one really knows what hospitals are doing and if they are strictly following the CDC guidelines outlining COVID care. Do I think hospitals are cheating to get extra insurance money? I should hope not, but people do manipulate books and figures every day.
That's true.
The other scary fact to me is that no one can provide an accurate count on those who came down with COVID, have had it and recovered, or who have actually died from it without having existing medical conditions.
Bingo.
Until we get that, none of us will ever know if it was just a big hoax that covered the world."
That's very well said,
It is,
Mark.
That's very profound is what
That's
that
a
is.
great way to actually wrap up our opinions. But here again, they're asking the same question. They're as confused as we are. We can't get accurate numbers. Special K, you had something you wanted to throw in?
Well, this may not relate, but I think just this morning I was watching a news channel, and there is a mayor in Nashville
Oh,
that
I saw that.
held on to some information on their COVID numbers and decided not to make it public so that he could keep the bars and restaurants shut down.
And that was the Nashville mayor.
Nashville mayor,
Yeah.
who is
hell.
a Democrat.
And one of the country
Go figure,
singers I was reading, doing
Yes,
some
he
more
did.
research.
I can't think of his name
I
right now.
can't either. He's about to file suit against the mayor for doing that.
Well, that's because he's got a bar that he owns and operates in Nashville. So, along
boy.
with his singing.
Yeah. And look at all the musicians and singers that have been affected by this.
Yeah.
You know.
Well, the whole entertainment industry.
Yeah.
My daughters and I go to the theater about 8 times a year, and our whole 2 seasons have been canceled.
Well,
because
that's the
they're-
Dallas Summer Musicals.
Dallas
for the,
Summer Musicals,
It's
and
not
they've been
going
canceled.
to a theater to watch
Yeah.
a motion picture
Yeah,
show.
it's musicals, and
Yeah.
that was our mother-daughter, and it's been disappointing.
Yeah, it really has.
And they're following the New York guidelines as far as the entertainment world is concerned.
Well, thanks for that.
Yeah.
Thanks for that.
That's ridiculous is what it is.
But here again, I think the whole bottom line is nobody really knows, and that's what is so damn frustrating.
Well, and Tennessee's a red state, is it not?
Yes, as far as
Well,
I know, but
They'll
but
burn that damn
na-
place down and run that mayor's butt off.
well,
What
the
they'll do.
country singer is asking him to resign because it's not only hurt his business but hurt every business in Nashville.
Good Lord.
So
That is so crazy.
it is nuts.
Yeah, but we appreciate you guys sending your thoughts.
That was a great.
Y'all
That was
rock, you
that
know.
was a great question today, Pappy.
It was.
I got to
you know,
give I got to give credit where credit's due. Pappy
Well,
came up with that just as an afterthought, but it was a great one.
I kind of stole it from somebody
Oh,
on,
did
my,
you? Okay.
on my personal Facebook page, and I should have written it down. I apologize. You know who you are because you remember the show as well. So next time, send it to grandpaandpappy@gmail.com.
We want to get into some viewer comments because I wanted to get to one in particular, Pappy, if I may.
Okay.
It really touched me. My friend Chuck Francie, who owns Armadillo Construction in Greenville, Texas, shared a story to me about doing something nice for someone. It had to do with him, as a matter of fact.
Oh, okay.
He related to me that one of his workers had family move in with him last week because their neighborhood was destroyed in the recent hurricane. He went from 3 people in the house to 18 people.
Good Lord.
When Chuck and his wife Renee found out about it, they just about emptied out their food cabinets and gave it to them so that they could feed the family. Chuck said it's during times like these that people should come together and help each other out no matter what.
Yeah.
Family is family,
Yeah.
and we take care of them. We didn't do it for praise or recognition. We did it because that is what God expects us to do. Now, this is coming from a good friend of mine. Chuck just saw his wife Renee through massive chemotherapy for breast cancer.
Oh boy.
And I'm very happy to report that the cancer is gone, Pappy, and Renee
good.
is doing just fine. But
good.
he had to go from taking care of her 24/7 during this period, and still had the wherewithal to help one of his
18 people. You know, the world.
one of his workers.
The world would be a
Good
better
job,
place to
Chuck.
live if we had more Chuck and his wife,
Renee, yeah.
Renee.
And if you in the Greenville area down there and you need anything done construction wise, call Chuck at Armadillo
There
Construction.
you
This
go.
guy is good.
There you go. Okay, moving right along. Brad actually wrote on YouTube how much he enjoyed our program on the Rebel flag, which was one of his thoughts
That
he
was
sent
his
to us.
suggestion, yeah.
He says, I love the comments and hearing everyone's opinion. I'm glad that I was a part of you guys' show. Well, Brad's a personal friend of mine. I'm glad as hell you're part of the show too, brother. Love you, man.
Absolutely. Spread the word, Brad.
That's right.
P4T wrote on YouTube about term limits. He said Congress will not support their own term limits. The only way to bypass it is with a constitutional convention of states, and he is correct.
Absolutely. And Sheila Roscoe Rollins wrote on Instagram about our solutions to the racial tension show. She said, as one of your viewers' comments said, the answer's simple. Just start treating each other as human beings and the rest will work itself out. Love the show.
Sheila, that is correct.
We love having you on board with us. Thank you for that comment.
It really is. And finally, James Kimball wrote in to say he watched the show on 9/11 with his cousin. I was really surprised to hear all of the comments from your viewers and the fact that you actually read them. My cousin Mark said you need to watch these guys. They make a lot of sense. I believe him, and I'll subscribe to your channel. Good luck on future shows.
Well, thank you there, Ruchacho.
James, thank you very much. That's very kind of you.
Yeah, well, and that's exactly what the base of this show's built on, is your comments. Like I've said, and my partner, Grandpa, has said many times, we just broadcast it. Y'all come up with the ideas, and we broadcast it.
And if you have an idea or a suggestion for this show, it's your show. We're just reading your comments.
That's right.
Just send it 2 ways to us. First of all, you can go to our Gmail account, which is grandpa and pappy at gmail.com.
Absolutely. Or you can hit us up directly on our show website at www.grandpa and the letter N, that's grandpanpappy.com. While you're there, you'll see that big red button that Special K just magically made appear. Push it and subscribe to the show. You know, we love.
I ask you a simple question.
Yeah.
Give us a password only you know.
Yeah.
Takes you right to YouTube. You're subscribed.
Yeah,
Bingo. And
you
it's free.
You can also leave comments, complaints, show topic ideas in the comment section.
Yeah, because down below you got room for Twitter, Instagram, and Facebook.
Yep, absolutely.
You can go in there and comment.
Yeah.
It's been a lot of fun. Coming up on our next show, Pappy, it's one we're getting a kick out of on some of the comments.
Oh boy.
Do you forget to wear your face mask?
I had to steal this one from my cohorts just 30 minutes ago because I walked out of the house and forgot mine.
I do everywhere. I can't get used to them. I start walking into a store and I see everybody coming out with face masks. I go, damn, gotta go back to the car.
Walk back to the car.
So anyway, that's what our show on Monday is going to be talking about. Until then, we want you to have a wonderful weekend.
Yep,
Be safe, be careful, and take care of each other.
that's right.
Pappy always joins me in saying as we close out our show, always hug your kids and tell them you love them.
Tell them that the Grandpa and Pappy Show loves them too.
Absolutely.
Love them babies.
Have a great weekend, everybody. We'll see you back on Monday. Till then, both of us say bye-bye.
Take care.
See you then.